Bye. All right. Come on. There we go. All righty then. Hey guys. Wow, I got 16 already. Okay. So, hi Ivory, hi Gwen, hi A, hi Mrs. Taylor. Thank you all for joining me. Hi Janiqua. Thank you all for being here. This is a little bit of a surprise again. I hope I'm not getting y'all too used to this, but this has been a very busy week. And I filmed earlier, but I didn't like the way that it came out. It's the perfectionist in me. What can I say? So I said, you know what? I'm going to go ahead and talk to them live tonight because we are going to be talking about the self-study tips. I've been getting a lot of this question lately about self-study tips. And how do you learn medical coding, Blue? How is it that I haven't learned in a while, or maybe I'm doing the independent study? Do you just start looking at the book and just start looking up codes? Is that how you learn medical coding? No. So I'm going to talk about it today. If you're brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. So we are talking about how to self-study for medical coding. A lot of people think that medical coding is just looking up codes or just pushing through whatever the provider wants and you should be good to go. This is wrong because a lot of times when you are looking at the documentation, you have to understand what you're reading. You have to know the language and you have to understand everything. All right. We have to know what doctors know while never having gone to medical school. And so with this said, the first thing that you need to learn before you start looking at coding is the medical terminology. That's your very first thing to learn. And I'm going to be reviewing the independent study video list that I have out there. It's the template that I have out there for you all. It's free. It's in the description box. It's going to be when I update this video. But normally it's with the independent study video that I have on my channel. If you look through my videos and you type in independent study, it'll pop up. And there's quite a few of them, so that's why I labeled this one as the 2023 version. So I'm going to go ahead and read from what I have, and I've sort of put it together. It's the steps for learning independently on your own. So if you are a nurse or somebody who has a medical background and maybe you want to learn this on your own, and so you say, well, Blue, I already know medical terminology, anatomy, and patho, that's fine. I do recommend that you still at least review it because I've talked to many nurses who have said, yeah, Blue, I kind of really wish I would have done the anatomy review at least before I started getting back into the coding, because sometimes you just forget stuff out of nursing school. So there's no shame in it. It's actually going to set you up for success. There's another channel that I watch. It's Think Like a Horse. The guy's name is Rick, and he always says the slow way is the fast way. If you learn something slowly, you're going to be able to do it faster later. So this is why I say get those foundation building blocks in, all right? So with the independent study video, the template goes like this. If you work through it, it'll take you about 9 months to 12 months altogether, all right? And that's reasonable. If you're trying to get through in 6 months or God forbid 4 months, you're really setting yourself up to fail. Because while you may be able to pass a test, maybe you're one of those ones who can pass tests very easily, it doesn't necessarily mean you're going to know what you're doing when you get out into the real world, and you're ill prepared for those tests that the employer will give you. So this is just to make sure that you're ready to go, all right? because I'm all about setting y'all up for success. So the first one is medical terminology. Now I do have the workbook in here on this list, and you can work through the entire workbook. You don't necessarily have to use the workbook that I recommend. These are the Amazon affiliate links, but you don't necessarily have to use that particular book. If you find another medical terminology workbook that you like, that's fine. Work through that. It's just a matter of getting that knowledge in about building the words, because you're not going to work on whole words. You're going to work on parts of words so that you can piece things together. You always learn your prefixes, your suffixes, and your root words. When you can nail those down, you can piece words together, and it's a lot better than trying to learn a bunch of words, because if you try to learn a bunch of words, you're just going to get overwhelmed. Okay, so work on your medical terminology for at least 8 weeks, and trust me, that 8 weeks is going to fly. And if you are working with the video that I did yesterday was about setting up a 20-hour per week study schedule. Now, yes, it is possible, even if you are working a full-time 40-hour-a-week job, you have a family and kids to take care of, you can still manage to study for 20 hours per week. So I talked about it, how to do it. I posted the templates for that on my Instagram page for the channel, Medical Coding with Blue on Instagram. You can follow me there if you want to. But the pictures are there, and it gives you just the different options that you can use for studying 20 hours per week. And it is possible. So you can get through this and have that review, and you'll be ready to rock and roll. That's all I'm saying. So the first one is that medical terminology. Learn that, get that foundation going, and you should be good to go. Then your anatomy and physiology, all right? And that's going to piggyback off of that one for another 8 weeks. Now, anatomy and physiology, depending on the workbook that you get, it can be very difficult. The one that I have, the Essentials of Anatomy and Physiology, is just a very general one. To me, I think it's a really good deal. I like the way that it's set up. It does have the workbook with it. Yes, be sure to get the companion workbook. So I don't know what happened to that link. I may have to look for it again. But if I don't find it, you guys can certainly pick another one with the companion book with it, okay? So work through that, and that way you can learn your anatomy and physiology. And I tell you, if you get overwhelmed with anatomy and physiology, just break it down by systems, okay? Learn your bones first, then your organ systems, or you can learn your organ systems first and then your bones, and then you can learn the muscles, and then you can build from there. But get going, okay? It's just something about getting going. That's the whole thing, okay? If books bore you, like you don't want to learn from a book, you can certainly check out tons of channels on YouTube about anatomy and medical terminology. And it doesn't necessarily have to be anatomy for medical coders. It can be anatomy because everybody uses the same anatomy. So, but yeah, do that. Work through that for 8 weeks. I also have the flashcards that I recommend here as well. There's also an anatomy coloring book. So sometimes if you engage your brain in different ways, like watching the videos or even working with the coloring books, that can help you to retain your anatomy. So that way it's going to make more sense. I've given a few examples before on the show about how anatomy and medical terminology can really throw you off. Because I've asked people, where is the talar shoulder? And people look at me, oh yeah, it's got to be in the shoulder. You just said shoulder. Actually, it's part of the foot and ankle area. So it's the name, okay? And then like the gastrocnemius muscle, where is that? Oh, well, that's got to be in the stomach, right? No, it's the calf muscle. So again, learning your anatomy is going to really help you, and so will learning your medical terminology. So stick with that for 8 weeks, and that's it on that one. And then I have step 3 is learning your healthcare reimbursement, HIPAA and OIG for a total of 8 weeks. So this is going to help you to understand the laws. Everybody has to know HIPAA. Everybody has to know about medical law and ethics. And the book that I do recommend, it's Law and Ethics for the Medical Professional. It's got everything in that one particular book. So I'm going to leave that link in the description box below. You can certainly get that and read through that whole thing. If you get through this part faster than 8 weeks, that's great, but at least you have your knowledge, because again, all the tests are going to cover HIPAA and the OIG and all that kind of stuff. So all the legal stuff, it will be covered on every single medical coding certification exam. So 8 weeks on that. And then I also gave some extra websites like cms.gov. Now, a lot of people get overwhelmed when they see the CMS website because there's so many things on there. But if you go to the Medicare Learning Network, and you can look in the little spyglass box and type in Medicare Learning Network, and you'll be able to see all the publications that are published there for free. So you can see everything about medical coding and just the things that pertain to us as health information professionals. So that's just something that you always got to know. It's a free resource out there, and that's always a good thing, you know. And then I also listed the OIG website if you want to look at that, and the Health and Human Services website, hhs.gov. Okay, it also covers for HIPAA too. And then you get into step 4, and that's going to be your ICD-10-CM. So your diagnosis coding. So with all of that, and I forgot to mention pathophysiology, I also have the workbook and the book to that one in the list of books that I recommend. I just didn't add it in here, but you can certainly incorporate that into that time as well. But for ICD-10-CM, that's your diagnosis coding. Everybody's got to have that. And when it comes to that, there's a one book that I recommend. I showed you guys the other day. This is the book. Now, this is the 2019 version. You don't have to get the 2019 version. You can get the newer version. But if you get this one, it's a little bit cheaper. Although it was $39 when I first started mentioning this book. And now I've only been able to find it for like $80-something. So you may be able to find other versions cheaper than that. But this is a great book. This is by the American Hospital Association. And when it comes to who I trust and who I think is the best when it comes to teaching new people how to code, this is the best book out there. This beats out Bucks in my opinion. Bucks is a very advanced type written book. To me, it feels like you should be a coder already reading that book. This is the other way. This is very beginner user friendly. It's got a lot of really good scenarios in here. It does have the answers, does have the rationale. I highly recommend this. Get the one with the answers. They do have the version without answers, and it is really cheap. However, how do you know if you're getting the correct answer? So at least this way you get this and it'll explain it to you. But this covers your diagnosis coding. It also covers ICD-10 PCS. Now, if you are taking either the CPC or the CCSP, you can skip the PCS portion and just stick to looking at the ICD-10-CM part. But if you are learning for the CCA or the CCS or the CIC, then you want to work through the whole book because it's going to have that PCS part in there too. So this is the book that I recommend. Here on the template, I recommend 12 weeks. So that way you can have the time to go through this. You look at how many chapters it is. You divide it up over those 12 weeks, which is the 3 months. You divide it up over that. So that way you can, sorry, I lost my train of thought, that you can get through there and practice. So that will help you. And even when you're preparing for your certification exam, then you can work with this one, okay? And then the next one is the step 5 is the current procedural terminology, CPT and HCPCS. The estimated time is 12 weeks. The one that I recommend for that is a CPC study guide. And you can use that even if you're taking an HEMA exam. So even if you're going for the CCA, the CCS, the CCSP, you can get that. So that way you can use that to study with. Now, even though it says AAPC, we all use the same CPT manual, and it's covering all the CPT codes. So that's what I want you guys to know. When you are working with that book, it's still good for you even if you're with a HEMA, okay? You can still practice with it. It's got a lot of really good scenarios in it. I was gonna try to show it to you. I don't know where I don't know where it is. But you can still practice with it. It's a great book. It's got the answers. It's got the rationale. There's only a few of the scenarios that I kind of disagree with, but for the most part, all the coding in it is really good. That's just what I'm gonna say on that one. So again, I estimate that one for 12 weeks. Then I have the PCS on here. If you're not studying for PCS, if PCS is not on your test, again, if you're taking the CCSP or the CPC, then don't worry about ICD-10 PCS on the template. And then it says step 7 is the certification exam preparation. And I say 2 to 4 weeks, because if you're consistently studying the whole way through this program, or this template actually, if you're consistently studying, you're going to be ready by the end of this to be able to sit for your certification exam. It's not going to be that you're going to have to take a long time to study afterwards, because there's nobody to cattle herd you through this program. It is all just about going through the steps and then getting to that part, and you should be ready within 2 to 4 weeks. But if you don't feel like that is enough time for you, you want a little bit more time, don't go past 3 months from the time that you finish, with the last book. Don't go past that time, because the more time that passes as you complete the program or the template, the more you're going to forget things. And so you don't want to do that. You want that stuff to still be fresh in your mind. So that's why I say at least 2 to 4 weeks, no more than 3 months afterward. So, and that's pretty much it, guys. I mean, that's pretty much how you study. It is just a matter of really being driven to study on your own, because it does get a little mundane. It can get boring. But when you feel yourself getting bored, then I recommend switching it up. Like if you're already working in the coding part and you're saying, well, I'm really getting bored reading this stuff, then start looking up procedure codes, as far as like working with the CPC study guide or working with the ICD-10 PCS book. In the back, there's in the Optum 360 coding book. In the AMA, it does have it as well. In their ICD-10 PCS book, it has the appendix with all of the hundreds of procedures that you can look up. And sometimes that's the best practice, is to look it up and to actually get in the trenches when you've reviewed everything and you're like, okay, I still don't understand. If you look up the codes themselves and then you look up the answers in the back, it will start to make more sense. And then you can word associate certain procedures with certain approaches and that kind of thing. So that's what helped me when I was learning PCS, because I don't have hands-on inpatient coding experience like working with PCS and working with DRGs and things like that. I've always only been on the outpatient side. So that challenge was very formidable when I was going to go take my CCS exam, because I'm like, here I am, 13-year veteran, and I don't want to mess this up. So that's where I really had to dig my heels in and study as much as I could with that PCS side. So that is what I did, and that's what I recommend to all of you. But again, getting that first part down, as far as that medical terminology, that anatomy and the pathophysiology, it's going to help you. If you try to skip it, it's going to make your life miserable, because you're going to be lost and you're not going to understand what's going on when you get to the coding part. So I'm just saying. But let me see all these comments. All right. Gwen says, I'm practicing with these examples. Hi, Emerald. Media says, taking my CPC exam next Saturday. Hi, Raspberry. Yes, great questions. Hi, Medina. Alexandria says, hi, everyone. Hi, Marie. Alexandria, do you have any book recommendations on dental billing? No, I don't. Because when it comes to dental, actually coding for dental, a lot of times it's done in-house. And it's just really a lot of the same things again and again. And usually they have their people that do it. And so not a lot of people that I know do that for dental. But we can always let our fingers do the walking, Hi, Jessica. Let me see what comes up here. If there is a book on dental billing. I think Optum might have one. Dental billing. and coding books. Somebody already looked that up. They have the coding and payment for dental services. Yep, I was right. Optum has everything. Optum360coding.com. They have the book. 2023 Coding and Payment Guide for Dental Services. And that's $83.68 right now on the Optum website, according to this. So that would be what I would recommend, for sure. And then they have the OMS, Oral Maxillofacial Surgery Coding Coding Companion. They also have that one. It's $200 for the 2023 book. They have the CDT. That's the current dental terminology, right? So that's that one. Now I will tell you all about the American Dental Association. They don't fool around. They've got those codes on lockdown. So I will say that they are very, this is mine. You can't have these codes. So that's why you don't see a lot of them. But the CDT, they have the coding companion there from the ADA. And so that's $54 on this other website, which I don't know where this is. And it's going to take me down a rabbit hole, which I don't want to go down because you guys know how weak I am when it comes to these books. I will go shopping for books, and then by the time I know it, out of control. So, but yeah, so those are your options right there. Optum 360. They always have a lot of really good options there. So, alrighty, what do we got here now? So, empty samples, is that good that you know of? So I heard somebody mention that that's the medical transcription, and I heard somebody say that they were actually practicing coding, reading those medical transcription notes. And so I thought that was a fantastic idea. So I haven't been to the site, but I mean, if that's what you want to look at, that's what you want to use to practice with, by all means. I welcome anything that makes you guys practice, because practice makes perfect, guys. I mean, that it really does. It's no more true than that, right? Hi, Rebecca. Alexandra, thank you. You're the best. Hi, Kay. Late to the party. Hi, Blue. Hi, everyone. Hello. All right. So that's what I would say about that. And like I said, studying medical coding on your own, it can get a little bit on the mundane side. But again, the best thing that I can recommend for you guys to do is to change it up. When I was studying for the inpatient side with the ICD-10 PCS, that was sort of the thing that I look forward to. Even though, which was looking up the codes in the back of the Optum 360 ICD-10 PCS book. I really kind of looked forward to that after a while, once I got it. At first, I was very slow and I would get very frustrated. I was like, oh my gosh, why can't I get this? And then I realized, once I started listening to myself, like I was tired and I was fatigued and I was going for too many hours. I was going for long hours and not just taking an hour and then taking a break, which is why I tell you guys now, take an hour, take a break, then go back to it. Because if you try to stay past an hour, you're not going to retain anything. And that's what I found for me. So that's why I say, if you want to go ahead and just practice that way, that's great too. There's also like workbooks, not workbooks, but like it's medical terminology, crossword puzzles and things like that. They have them on Amazon. I have them on my Patreon channel. I posted them before. I have word finds. I have crossword puzzles. So I have all of that available to my Patreons. So if you're interested in that, the link for my Patreon is going to be in the description box below, but it's in the description box of all of my videos. You can certainly go over to Patreon if you're interested in that. The pledges start at $10 per month. You certainly don't have to pledge past a month, but $10 gets you access to everything I've posted, and plus access to the once a month live that I have on Zoom. It's a study hall. This month I'm going to be discussing, what is it? Oh yes, the E&M, when the E&M applies to a minor procedure. So there's a little bit of a distinction there when we're talking about minor procedures and E&M, okay? And there's a lot of misconceptions about that. So many. But I'm going to address that in that live session. And the next one will be, that will be on February the 18th. So if you're interested in that. Let's see. Viola says, good evening. Any tips for self-study on inpatient coding and DRGs? My course doesn't really cover ICD-10 PCS, mostly outpatient. It sounds like they're preparing you either for the CPC or the CCSP. You will find those, and just as I mentioned before, in the self-study recipe template thing that I have, you can get the ICD-10 PCS and ICD-10 CM and ICD-10 PCS. Get this book. Use this to practice. This talks about everything you need to know for inpatient coding. And so this is a great way to start learning that stuff. You can also Google for resources and references about DRG. You can search the CMS website. There's a lot of free downloadable resources that talk about DRGs. So if you're wanting to sit for the CCS or the CCA or the CIC, this is going to be your best bet because these are all going to cover for inpatient. Okay. Let's see. What do we have here? Notary says, fast track junior college ICD-10 PCS is not working for me. It was just way too fast. No refunds, but I still have my books to study on my own thanks to Bleu. And see, that's great. And even if you find yourself in one of those fast-paced coding programs and they said all these great things and oh yeah, it's going to be so easy and this is going to be a piece of cake, and you find yourself in that program and then it's just not what you wanted or it's too fast, it's okay to get all the materials and study on your own. You can use the independent study template that I have to augment your studies. It's not impossible to learn on your own. Again, it just takes a lot of discipline. And sometimes it's very hard, very hard to be motivated. But when you look at your goal and why you want to do this, why do you want to be a medical coder? What is it that you're looking at getting into this? What is it going to fulfill for you? And when I first started, what it was going to fulfill for me was having a good job. That was what it was, because that's the way that I thought of it. I didn't think of it as a career at that point because I didn't know anything about it. It wasn't until I was into it a few years, and then that's when the light bulb turned on. I'm like, now I get it. So, but not everybody gets that. Some people will like their job. They will enjoy it. This will always be a job to them because that's the way that they've looked at it. But sometimes when you really get into it and then all of a sudden you find yourself, you change and you start looking at it in a different light, and then all of a sudden it becomes more interesting. And then all of a sudden you just can't wait. You can't wait to get to work. You can't wait to perform provider education, or you can't wait to help your coworkers to learn more. That's what I love. I love that. There's nothing better to me, of course, than a great note, right? But then to see people learning. And when I am part of that, when I'm part of their, oh, now I get it. That's just like that. It does something to me. I get so happy when I see that. And I don't do it for like glory. I don't do it for, whatever. I do it for me. And so that's when I see that, to me, it's just a great thing. And that's what makes me love this even more. And then the fact, of course, that it updates every year and it changes all the time. And we just have to be along for the ride. Sometimes it does get a little frustrating, especially when things are going very well. And then all of a sudden, oh no, we have a rules change. And so that's where it's just like, really? So that's why I say, you always have to be prepared. And this field will teach you about preparedness. It will. And the more prepared you are, the more you improve yourself, not just professionally, but personally, the better off you'll be, the stronger you'll be. And that's really, what it all comes down to, and as long as you're enjoying what you do, that's a great thing, because we only get one rodeo, folks. This is not a dress rehearsal. Life is going on right now. And for a lot of people, they say, well, Bleu, I really wish I would have learned this years ago. If you didn't learn it years ago, there's a reason. You're learning it now. Now is your time. Because if you had been in it sooner, you may not have appreciated it as much as you do now. So, all right. Let's see. Elizabeth says, I'm glad I found your videos. Oh, being 59 years young, I love them. Oh, great. Well, thank you for being here. Merck says, hi, Blue. Everyone, I'm getting my new coding books today. I'm very excited. I'm excited for you. Elizabeth says, I found books on eBay and thrift books are for really cheap, starting at $5. You see, it doesn't take much money, guys. It really doesn't. Hi, Christine. Thank you for joining me. Gwen says, looking for that get it moment, happiness. It does. It'll show up out of nowhere. Trust me. Notary says, the only thing I learned was going to the index first and then locating the root word, and then I got lost. I explained this to my instructor and just explained to her, sorry, but I have to take the self-study way. You shouldn't be sorry. You shouldn't be sorry for saying that you have to take the self-study way. Not everybody is trained to teach adults. For some people, it's a natural gift that they have this ability to be able to teach others, and it's just a natural thing that comes to them. And for other people who are teachers or instructors, they do it because they don't want to be bothered with productivity. They just want to be able to teach, and they're happy to teach from a book, not really using those critical thinking skills, not stretching and growing the people. They just say, well, this is just an easy job. I can do this. And so there's people out there like that. But you should never be sorry for, saying that this doesn't work for me. I need to figure out another way. And that's the way you should look at it. Like, okay, this doesn't work for me, so I need to work it another way. And when you do that, then the world becomes your oyster, because it's not about like, okay, I'm going to conform to this, even though it didn't work for me. You can learn a lot more once you figure out like what's going to work for you. And I've heard of some students saying that, they would get lost and the teacher would get very frustrated, and then they were scared. They didn't want to go and ask questions because they didn't want to get the teacher to be mad at them. To me, if I have a question, I got a question. If I feel like you can't answer me, then I'm going to find somebody else who can answer me. I'm not going to be scared about it. And that's not something that anybody should be afraid of, but that's just, just a learning process. That's all it is. But yes, once you get past that part, and it is a little hard in the beginning to try to figure it out on your own. But again, if you go through and you're looking up like in the ICD-10 CM and ICD-10 PCS coding handbook with the answers, and you're looking at the code and it doesn't quite make sense, like their answer, and then you kind of look it up in the back in the tabular section, and so then you can kind of retrace how you would get to it in the index, then that can kind of help you too. And if you have the Optum 360 coding books, the ICD-10 CM book, it comes with the beginning of every chapter. There's a whole thing about examples and the rationale and why. Well, the rationale, but it does explain what the answers are and why. So I think that's a great read for brand new people. So if you read something like that, after a while, when you get your practice looking up the codes, it's going to get a lot easier, because then you're going to kind of understand why. Also, if you are reading your coding guidelines once per week, that's going to help you too, because there's a lot of answers in the coding guidelines on how to do certain coding, right? Because like, especially for injuries is a hot topic, because there's a lot of people that don't really quite get it when it comes to injuries. And some people think that it's appropriate that, oh, if the patient's already been seen in another place and they're being seen by a brand new provider, then all of a sudden it's a brand new patient. No, it really depends on what's happening in that second visit. If that patient was seen at one place and then they go to a different place, and that second provider is like, well, we're going to go ahead and continue whatever treatment that they had you on, and there's nothing else wrong with that patient, then that's going to be a subsequent visit, because that patient's already in the healing phase of their injury. For those initial injuries, it's going to be when they're actively treating a patient. That's when it's going to have the A, not because they're being seen by a brand new provider. Okay, so that's all about understanding, understanding and comprehending those coding guidelines. That's why reading the guidelines really does help, because somebody can say, what is this injury code? And you're going to say, okay, well, what is the context of why are they receiving treatment? Is this a follow-up? Is this an initial? Is it a subsequent? You know, what are we doing? So that's one of the things that, you know, reading those coding guidelines will help to kind of clear up, because it's all there. And again, it's not going to make sense the first few times that you read it, but after a while, when you do start to read it more and more, it will start to make more sense. You know, I'm just saying. So but yes, hopefully that has helped. I hope you guys have checked out the 20-hour like templates on how to hit that, because that really does help too. Because once you have that time, there's going to be a huge difference between a student who spends 10 hours per week studying versus a student who is spending 20 hours per week studying. I'm just saying. A says, when in my HIM program, I discovered that I was in the minority because coding just made sense to me and I loved it. And see, when you're in those HIM programs, like if you're getting your degree, right? Your RHIA or your RHIT, you're going through one of those approved programs, right? It's the coding is actually a very minor part of those whole programs. Those programs for college are really sort of concentrating on the laws and the ethics and, you know, human resources side of the house and stuff like that, because those are our managers. But I really do think it's great when a HIM student, an HIM professional knows and understands coding, because even managers that are in these hospitals, that are in these doctors' offices, they are going to have to be the ones to break the tie when there's a disagreement between the auditor and the coder. And it's a really great thing when the manager knows coding, because they can say, oh, well, yeah, that sounds about right. Or they're just going to side with the auditor because that's what they want to stick together. And that's not right, because if a manager knows that the coder is correct, then they need to say, you know, we've had this discussion before at a place that I worked, and it was the manager who came in and broke the tie, because it was a disagreement between me and the auditor, and the manager sided with me. She didn't know that it was me that had responded that way, because we wanted to show that it was neutral, like who is it, because they didn't want anybody to say, okay, well, it's because you favored this person or that person. And so they were like, okay, it's a blind it's a blind answer. This person said this and this other person said this, who is correct? And then they go, this answer is correct. It was my answer. So, you know, again, it was neutral. It was a neutral thing. And she didn't have to say, oh, it's because it's blue. No, it's not because it's blue. It's because the answer is correct. And her understanding coding really does help with that, you know. But I've seen it both ways, where like HIM managers have no clue about coding, and they're just like, okay, yeah, whatever works. But, you know, no, you can't do that, because to me, that's letting off too much of the responsibility onto somebody else when you are the captain of the ship. And when you are the captain of the ship and it is your vessel and something goes wrong, it's on you. So you better know about what all these other people are doing and their roles. I'm just saying, you know. No, there isn't. Alexandria. I'm sorry, Alexandria. I'm tired today, you guys. Can't you tell? It's crazy how many of my supervisors don't know anything about coding. Scary. That is frightening. That is very frightening. Viola says, thanks. I coded for many years as a RHIT CCS, but had a career pause before ICD-10. I'm getting back into coding, but I don't want another HIM degree. What self-study program is good for someone like me? Did you just come in midway? Because I talked about the self-study. Did you come in midway? Did you miss all of that? A says, our HIM classes were serious and high quality, and some of the instructors I did. Okay, I'll go over it again in a second. Our HIM coding classes were serious and high quality with some great teachers, and we were coding actual scenarios from redacted records. And I think that we could have done the CCS right out of school. And see, there's some really good programs out there like that. I've heard of them, you know. I don't know them personally, but I've heard of some people say that they were really tough programs, and they prepared them well, and they did really well in the CCS. And I think that's fantastic, because that's producing really good coders. And there's a lot of schools that are not really concerned with the quality of the coder that's being produced. They're just concerned with the number of coders that's being produced. And that's not right. And so on my channel, I will say time and time again what this field really is. And when people respond, oh, thank you for posting this, because I just dodged a big mistake that I was going to make getting into this field, then this field wasn't for you. And I'm glad you did your research before and you spent all this money. Because more often than not, I hear people spending $20,000 or $30,000 on a student loan for a medical coding credential. And I would never do that. I would never spend $20,000 or $30,000 to get like a CCS. Never. Because to me, that's just too much money, when you can go to the association websites and get it for a fraction of the cost. You know, with a HIPAA, it's like about $4,000 or $5,000, not $20,000 or $30,000. Certainly not. And certainly not getting a student loan for that. Never. All right. I did answer your question, Karima. Nikki says, my school, DeVry. There, that takes care of that one. All right. Oh, no, not you. Wrong one. Okay. All right. So this is the one I want to put. Okay, when you tell me to answer your question, and I've answered your question, and then you tell me to answer your question, I'm blocking you. Because to me, that's rude, because I did answer you. So pay attention, and you know that I answered you. Nikki says, my school, DeVry, actually used one of your videos for their lectures, which was how I found you graduating at the end of the month, and I will sit for the exam. Well, that's nice to hear from DeVry. Which video was it? Do you remember? That's funny. All right. That's funny. I've heard of that too. Schools using my videos. That's great. You know what they do? That's great, because that means I'm doing something right. But schools like DeVry, no, it was one of my earliest classes. Oh, okay. Viola, can you comment something? Because I want to make sure that you're not. Can you please comment something? Because when I was putting the other user on block, it got flipped around. So I want to make sure I didn't block you on accident. If I did, let me know. Let's see. So Elizabeth says, my 6-year-old granddaughter wants you to say her name. Muffin? Hi, Muffin. That is so cute. Hi, Muffin. Thank you for watching. Okay, good. Good, Viola. Okay. All right. So that means you're still here. All right. So I blocked the right person. But going on, right? When you are learning, make sure that when you do all of the things that you're working on, and you're still kind of keeping track on the things that you've learned before, just make sure that when you do this, that you're testing yourself, so that way you're not forgetting anything. Don't forget the stuff that you learned way in the beginning, like with HIPAA and with, OIG and things like that. That way you can, learn and still be able to retain that stuff. Because trust me, the second you have to stop learning it, is going to go right out the door, and you don't want to forget that. So, All right, Raspberry says, HIPAA has a student membership for only $49, and the CCS exam is $199 as a student. Yeah, for their the programs that they are approved through HIPAA, you can get that student rate, and that student rate is awesome. You can get a lot of really good deals with that student rate. But once you don't have that student rate anymore, boy, I never had the student rate, unfortunately. I've always had to pay full price for mine, you know. Uh, Rocco, I feel like I've forgotten so much from the non-coding classes. And see, you have to be really careful about that because it can slip out of your mind so easily. And even if you have to like make a list of things like that are basic for like HIPAA and just have it in your workspace, in your study space, that makes a great study tool anyway. So that's why I say just kind of have it up so that way you can see it. I always say all the time, like if you go into these doctor's offices and you see these anatomy posters up, right? With these anatomy posters, they're not for you. They're for the doctor, so the doctor can remember where everything is at, you know. And that's why they keep that stuff around, you know. It just makes it easier, you know. If it's out of sight, it's out of mind. It's the same thing with knowledge and anything that you have to learn. Out of sight, out of mind. That's why repetition is so key. And that's why I say when you're reading these coding guidelines, it really does help when you space it out over a week and you take the time to read a few passages. And even if it takes you 2 to 3 weeks to read the whole thing, that's okay. Because with that, it's still retaining in your brain. And it's a lot easier that way. So that's just what I'm saying. I hate it when I get when I forget what I'm going to say. I was going to say something else too. Dang it. All right. Exactly. Medina says exactly because I data dump. If I don't use it, I lose it. Yep. I'm guilty of that too. I'm guilty of just walking into a room too and forgetting why I'm going in there. But anyway, all right. So does anybody else have any other questions before I wrap this one up for tonight? This was another surprise live because like I said, I know what I was going to do now, Viola. I did not forget you. Okay. Here we go. So if you are wanting to study on your own and you've been through a program, you want to, go over it again, or you want to kind of pace yourself your own way, I recommend going in this order. It doesn't mean that you have to necessarily spend all the time that I recommend doing these classes, but it does help to kind of like hold this information in. So step 1 is your medical terminology. You're going to do that for 4 weeks. Okay. You can work through a workbook. You can use word finds. You can use crossword puzzles, anything to kind of help you work on your medical terminology. You don't have to use whole words. You don't have to memorize whole words. But if you work on prefixes, suffixes, and root words, it really does help to build your vocabulary, because then you could piece words together. And don't skip this part because medical terminology is so very important to comprehending documentation, because it's so easy to make a mistake. The talar shoulder is which is part of the foot and ankle. I ask people, where is that? They immediately want to think it's the shoulder, and it's actually part of the foot and ankle. So again, knowing your medical terminology and your anatomy is going to go a long way. The gastrocnemius muscle, it's not in the stomach, it's the calf muscle. So, that's just something you got to know. Medical terminology will go a long way into that. And I'll be putting all of this in the description box after the show. Anatomy and physiology, estimated time is 8 weeks. I have the Essentials of Anatomy and Physiology 8th edition. There's also the companion workbook. For some reason, I don't have that link for Amazon here, but you can always look through Amazon for the companion workbook, and it'll obviously lead you to it as well. There's the Anatomy Quick Study flashcards also here. The Anatomy Coloring Book. If you are having trouble learning anatomy and you don't know where to go, you're just like, okay, well, I'm just really tired of this. The videos don't help me, like looking on YouTube for anatomy videos, but it's not helping me. Maybe a coloring book will help you. So there's the link there. The healthcare reimbursement, HIPAA, OIG. So there's a book that I recommend. It's Law, Liability, and Ethics for Medical Professionals. This book is very comprehensive, and it's got everything that you need to know wrapped up into one book. I love this book. So I have the link there, but I say that you can spend an estimated 8 weeks time on it. If you get through it in less time than that, that's totally fine. But the point is to get through that law, liability, and ethics book, because it's going to cover everything from HIPAA to the OIG and everything else in between. So that's why I recommend that book. There's also FAQs, frequently asked questions, on the sites like CMS that you can look at for free. There's also OIG and the HHS, which also help too, and I have those links there. Step 4 is learning your ICD-10-CM. Estimated time is 12 weeks. If you are studying for the CCS or the CCA or the CIC, you can combine this time with learning ICD-10-CM and ICD-10-PCS. You can use this book. This is the one that I recommend, okay? I'm always going to recommend this book because this one outfoxes any other beginner book, in my opinion. This is a fantastic book by the American Hospital Association. Nellie Chisholm is the author. You can get the 2019 version. However, it's gotten more expensive, but you can always get whatever book you can find. Get the one with answers. Avoid the one without, because you need to know if you got the correct answer, okay? Then do that for 12 weeks. Step 5 is a CPT. Again, another 12 weeks. Work through the AAPC CPC study guide. I believe in that book. I love that book. I will highly recommend that book, even if you are taking an AHIMA exam, okay? Because that's the one that I use to help me study as well. So we all use the same CPT manual, folks. We all do. So that's 12 weeks with that. And then, of course, I talk about PCS. And then step 7 is exam preparation. You should be prepared. If you are following the 20 hours per week study schedule and you are staying consistently on your studies, you should be prepared for the exam within 2 to 4 weeks. You do not need the prep manuals for AHIMA. If you're sticking with the AHIMA exams, you do not need those prep manuals, because none of those test prep manuals, none of those will prepare you for the test. It's just a test book, right? But a lot of people will depend on that book for, like, okay, if I did really good, this means I'm going to pass a test. And then they feel let down when they fail, because that test is very difficult. And I don't feel that the AHIMA books sufficiently prepare you enough. The prep books, the certification exam prep books, I don't feel that they prepare you enough. I still feel like if you've gone through the CPC study guide and that ICD-10-CM and ICD-10-PCS, that is sufficient enough to prepare you for the medical coding side of the CCS or the CCA. I'm just saying. So that was it. Violet says, great tips, thanks. Alexandria, thanks. Notary says, thank you so much and I appreciate you. My husband sat with me watching your last video and he said you are intelligent. Night. Good night. A says, the regulatory section seems to be the hardest on the CCS because we don't really deal with that on the frontline as frontline hospital coders. Where is most of that stuff to study? In that law, liability, and ethics book that I will have in the description box. Raspberry, pathophysiology is my weak point. I would check it out. The book and the companion workbook are going to be there in the description box too. Thanks for presenting a new video. You're welcome. All right, guys. Okay, so now I'm going to wrap this one up. You know me, I'm a Texan, right? So we always say bye, or we start to say bye, and then we say bye like 5 times, and then, okay, yeah. All right. So with that said, I'm going to go ahead and wrap this one up. But thank you so much. Yes, I am. Yes, I am. But I'm going to wrap this one up. Thank you so much for joining me. If you have a video request that you like to put in, leave a comment in the comment section. See, I stopped myself because I was going to say description box. I always do that. Leave a comment in the comments what video you'd like to see next. You can also leave it on my Instagram channel. I would be happy to look at those there. If it's something I've done fairly recently, I'll let you know. If not, I will add it to the things that I will talk about on the next episode. So thank you again, guys. Have a good night, Kay. Thanks, Christine. A is a Southern thing. is another good channel. Yes, yes it is. All right, guys. So I will see y'all next time. Bye.